Good morning. Imagine this. A loved elder, smiling at breakfast, and by dinner time they're gone. No long hospital stay, no months of suffering, just one moment and the next they're gone. It seems inexplicable. But what if I told you there is a common trait among those who pass suddenly in old age, and that there are warning signs you can spot? Today, I am going to walk you through 6 warning signs that many older adults show when their body is quietly slipping toward that sudden final moment. The goal is not to frighten you, but to make you aware, because awareness can lead to action, and action may mean peace of mind or precious extra time. 1. Rapid, unintentional weight loss or loss of appetite. One of the most important warning signs you can notice in an elderly person is sudden, unplanned weight loss. This doesn't mean they are simply getting thinner because of age. It means their body is quietly failing to take in enough nutrition, and that failure may be a signal of a much deeper problem. When older adults begin to lose weight without dieting, 2 major things might be happening. First, their appetite often decreases. They may say, "I'm just not hungry," or "food doesn't taste good anymore." Second, their body may stop absorbing nutrients properly, meaning even when they do eat, the food does not nourish them the way it should. Why does this happen? As people age, their sense of taste and smell naturally weaken, making food less appealing. Chewing can become difficult because of weak teeth, dentures, or dry mouth. Digestive issues like acid reflux, constipation, or nausea can make mealtimes uncomfortable. Medications also play a major role. Certain pills can reduce hunger, cause stomach irritation, or change how food tastes. Over time, a person simply stops looking forward to eating. More seriously, rapid weight loss can be an early sign of serious medical conditions. For example, cancers of the stomach, lungs, or colon often cause the body to lose weight. Thyroid problems can speed up metabolism and burn calories too quickly. Diseases like dementia can make a person forget to eat altogether. Even depression and loneliness, a common issue among seniors, can reduce appetite dramatically. When an older body is underfed, it becomes weaker. Muscles shrink, energy drops, and the immune system becomes less effective. That means infections, viruses, and small illnesses become more dangerous. Something as simple as the flu might suddenly turn life-threatening. Bones also weaken, increasing the risk of falls and fractures. In many cases, doctors say that weight loss in seniors is often the first visible sign of the body approaching frailty. Families may notice clothes getting loose, belts needing tighter notches, rings slipping off fingers, or a thinning face. Sometimes it happens slowly over months. And because you see them every day, you don't immediately recognize it. That's why regular weight checks at home are extremely helpful. Pay attention if someone loses more than 5% of their weight within 6 months without trying. That level of loss is considered significant and deserves medical attention. So what can you do? Start by encouraging small, frequent meals rather than large plates. Offer foods that are easy to chew and rich in calories like soups, eggs, yogurt, smoothies, peanut butter, or soft proteins. Make meals a social event, because older adults often eat more when they feel loved and included. Talk to a doctor about appetite-boosting supplements, vitamin checks, or changing medications if needed. Most importantly, do not ignore this sign. Rapid, unintentional weight loss is not a normal part of aging. It is the body's way of whispering, "Something is wrong." Listening to that whisper could save a life, or at least extend it with comfort and dignity. 2. Increased sleepiness or withdrawal from normal activity. Another powerful warning sign that many elderly people show before a sudden decline is a noticeable increase in sleepiness or a gradual withdrawal from daily activities. On the surface, this may not seem alarming. After all, older adults often sleep more than younger people. But when someone who used to be active, alert, and social begins sleeping excessively or losing interest in the world around them, it could mean the body is quietly weakening. As the human body ages, energy levels naturally drop. Muscles become less efficient, organs work harder, and the body takes longer to recover from basic tasks. However, when sleepiness becomes extreme, sleeping most of the day, dozing off during conversations, or needing multiple naps. Something deeper may be happening. It often means the body no longer has the energy supply it once did, and systems are beginning to slow down. There are many possible reasons for this sudden tiredness. Heart problems, for example, can reduce blood flow to the muscles and brain, leaving a person exhausted. Lung issues can decrease oxygen levels, making even small tasks feel draining. Kidney and liver decline can cause toxins to build up in the bloodstream, resulting in fatigue and confusion. Infections, even small ones like urinary tract infections, can dramatically affect an older person's energy. Medications also play a major role. Some drugs cause drowsiness as a side effect, and seniors often take several prescriptions at once. This can create a stacking effect, increasing sleepiness more than expected. Sleep disorders such as sleep apnea may also go undiagnosed, silently harming the heart and brain over time. Withdrawal from normal activities is just as concerning. A person who once enjoyed cooking, gardening, conversations, or watching television may suddenly show disinterest. They may prefer to stay in bed, avoid social gatherings, or simply sit quietly in a chair for hours. This withdrawal often signals a decline in either physical strength or mental health. The reasons can be emotional as well. Depression and loneliness are extremely common among seniors, especially those who have lost a spouse, friends, or independence. When the heart is heavy, the body becomes tired. Sometimes withdrawal is also a sign of dementia. As memory declines, familiar activities may become confusing or frustrating, and the person chooses to pull away. Regardless of the cause, families should pay close attention to changes in sleep patterns and activity levels. Ask gentle questions. Are you feeling tired today? Is something hurting? Are you bored? Are you feeling sad? These questions can open the door to important conversations. If the sleepiness is new or worsening, consult a doctor. Blood tests can check for anemia, vitamin deficiencies, infections, or organ problems. Review medications with a healthcare professional. Sometimes simply adjusting doses can improve alertness. Encouraging light physical activity, short walks, or social visits can help stimulate the mind and body. Most importantly, do not dismiss excessive sleepiness or withdrawal as just getting old. The body may be signaling that it is losing strength, and early attention can make a meaningful difference. Caring early may add months or even years of healthier, happier living. 3. Confusion, disorientation, or sudden personality change. Confusion and personality changes in an elderly person are often overlooked, but they are among the most serious warning signs that the body or brain is not functioning properly. When someone who used to think clearly suddenly becomes forgetful, mixed up, or acts differently, it can signal that something important is happening inside their body. Let's imagine a familiar situation. A grandparent who always remembers birthdays begins forgetting names. They lose track of what day it is, get lost in their own home, or start placing objects in strange places, like putting keys in the freezer or milk in the cupboard. These behaviors may seem humorous at first, but they can be early signs of more serious problems. One common cause of sudden confusion in elderly people is lack of oxygen or blood flow to the brain. This can happen if the heart or lungs are not working properly. When the brain doesn't get enough oxygen, thinking becomes slow, speech becomes unclear, and decisions become difficult. Sometimes confusion is the very first sign of a stroke or heart failure. Another surprising but common cause is infection, especially urinary tract infections, UTIs. Younger people might feel pain or burning, but older adults often show only confusion, irritability, or unusual behavior. Their body reacts differently to infection, which can be dangerously easy to miss if no one is watching closely. Medications can also play a major role. Many elderly people take several pills every day. Certain combinations can affect the brain, causing foggy thinking, sleepiness, or agitation. Even a small change in dosage can have a big effect. This is why doctors often review medications carefully when confusion appears. Sometimes confusion is caused by dehydration. Older adults often forget to drink enough water, and a lack of fluids can quickly harm brain function. You may notice dizziness, dry mouth, dark urine, or headaches along with the confusion. Confusion can also be linked to mental health. Depression, anxiety, grief, and loneliness are very real among seniors, especially after losing loved ones or becoming less independent. Mental stress can make concentration difficult, leading to memory problems and changes in personality. Then there are degenerative brain conditions like dementia or Alzheimer's disease. These conditions progress slowly, but sudden changes, getting lost, wandering, misunderstanding simple instructions, should never be ignored. Early diagnosis can provide treatment options that slow the condition down. What should families look for? Pay attention if an elderly person has trouble following conversations, forgets familiar faces or places, gets confused about time or location, becomes easily angry, anxious, or fearful, acts in ways that are out of character. Don't dismiss these changes as just old age. Instead, gently ask how they feel. Observe patterns. Are these episodes becoming more frequent? Are they happening at certain times of day? This information can help doctors find the cause more quickly. If confusion appears suddenly, seek medical help immediately. It could be a warning sign of a stroke, infection, organ failure, or severe dehydration. When caught early, many causes of confusion can be treated, giving the person more comfort, clarity, and independence. Remember, sudden confusion is the body's alarm bell. Listening to it can protect your loved one and even save their life. 4. Breathing difficulties, shortness of breath, or chest-related symptoms. Breathing is something we all do without thinking. But when an elderly person suddenly begins having trouble breathing or experiences discomfort in the chest area, the body may be sending a serious warning signal. Many older adults who pass suddenly often show signs of breathing difficulty in the days, weeks, or months before. Sadly, these signs are sometimes ignored because people assume they are just tired or just slowing down with age. Shortness of breath can appear gradually or strike suddenly. At first, a senior may feel winded while climbing stairs or walking a short distance. Later, they might struggle to breathe even while sitting or resting. They may start pausing often when talking or take deep breaths after every few words. This happens because the lungs aren't providing enough oxygen or the heart isn't strong enough to pump blood effectively. When the body cannot get the oxygen it needs, every activity becomes exhausting. One of the most common underlying causes in the elderly is heart failure. In this condition, the heart becomes weak and cannot pump blood well. Fluid builds up in the lungs, making it hard to breathe. Seniors might develop a cough that gets worse when lying down, or they may sleep propped up on pillows. Sometimes the ankles or feet swell because fluid collects in the body. All these are quiet warnings that the heart is struggling. Another common cause is chronic lung disease, such as COPD or pneumonia. Infections can be extremely dangerous for older adults. A simple cold can quickly move into the lungs, causing inflammation and breathing issues. Unlike younger people, seniors may not always get a fever. Instead, they show rapid breathing, restlessness, or confusion, warning signs that oxygen is low. Breathing difficulty can also be related to anxiety, especially if the person is scared about changes in their body. When the mind becomes stressed, breathing becomes faster and more shallow. This can make an already weak heart or lung condition worse. Anxiety and physical illness often feed off each other, making symptoms more severe. Some chest symptoms are subtle but serious. Elderly people may complain of a heavy feeling in the chest, pressure, or pain that spreads to the arm, back, or jaw. They may feel nauseous or break into a cold sweat. These can be signs of a silent heart attack, a dangerous type of heart attack that doesn't always show the usual strong symptoms in older adults. Family members should watch for signs such as rapid or shallow breathing, gasping or long pauses while breathing, blue or gray lips or fingertips, persistent coughing or wheezing, fatigue from very small activities. If any of these appear, it's important to seek medical attention. Doctors can perform lung and heart tests, adjust medications, or provide oxygen support. Sometimes, simple treatments can improve breathing dramatically. Encouraging gentle activity, fresh air, and proper hydration can also help support lung function. However, if breathing issues worsen, do not delay. Shortness of breath is not just old age. It is the body's way of saying that the heart, lungs, or circulation are under stress. Listening early can prevent emergencies, reduce suffering, and potentially save a precious life. 5. Frequent falls, loss of strength, or mobility decline. One of the most visible warning signs that an elderly person may be approaching a sudden health decline is a noticeable loss of strength and mobility. Many families assume that falling or getting weaker is just a normal part of aging, but this can be the body's way of saying, "I can't keep up anymore." When an older adult begins falling more often, walking slowly, or struggling to stand up, it should be treated seriously. Falls are especially dangerous for seniors because their bones are more fragile. A simple fall can lead to a hip fracture, and in many cases, older adults never fully recover after such an injury. Shockingly, a fall can sometimes start a chain reaction: hospitalization, bed rest, muscle loss, infections, and eventually, sudden death. This is why preventing falls is incredibly important. There are many hidden reasons behind falling that families may not realize. One of the biggest causes is muscle loss, also known as sarcopenia. As we age, our muscles naturally shrink if we don't stay active. Weak leg muscles make it harder to balance, climb stairs, or stand up from a chair. Poor balance increases the risk of falls significantly. Another common cause is poor vision or hearing. When eyesight fades, it becomes harder to spot obstacles on the floor. When hearing declines, it can affect balance. Elderly people might trip over rugs, pets, or their own furniture simply because they didn't see or hear clearly. Medications can also play a surprising role. Certain pills can cause dizziness, sleepiness, or low blood pressure. When seniors take multiple medications, side effects can stack up and affect coordination. Even the timing of medication can make a difference. Problems in the brain should not be ignored either. Dementia, small strokes, or early neurological disorders can affect how the brain processes movement. When the brain struggles to receive and send signals, a person may trip, shuffle their feet, or freeze when trying to walk. A decline in mobility often begins quietly. At first, an older person might avoid long walks or refuse to leave the house. Later, they may rely on furniture or walls for support. Eventually, they may spend most of their time sitting or in bed. The less they move, the weaker their muscles become. This creates a dangerous cycle. Inactivity causes weakness. Weakness causes more inactivity. Families should notice signs such as difficulty standing up from chairs, holding on to walls or countertops while walking, shuffling feet instead of stepping normally, complaining of dizziness or unsteadiness, bruises on arms or legs from minor falls, avoiding stairs or uneven ground. When you see these patterns, it's important to act early. Simple interventions can make a huge difference. Encourage gentle exercise like walking, stretching, or chair exercises. Consult a doctor for a physical therapy referral to rebuild strength safely. Check the home for hazards such as loose rugs, poor lighting, or cluttered walkways. Supportive shoes and mobility aids like walkers can increase safety dramatically. If dizziness, numbness, or weakness comes suddenly, contact a doctor immediately. It could be a sign of stroke, nerve problems, or heart issues. Most importantly, never ignore repeated falls or sudden weakness. These symptoms often reveal that the body is losing resilience. Paying attention early can prevent serious injuries, protect independence, and possibly extend life.